In this intensive care unit, the patients are very vulnerable ones, premature babies. To improve their medical monitoring, this hospital in Milan is testing a new tool aiming to reduce the risk of brain injury.
These premature babies are under constant surveillance. Their organs are not fully ready for life outside the womb, and there's a high risk of complications, especially for those born before 7 months. These are known as extremely preterm. More than 25,000 of them are born each year in Europe.
The risk of brain injury and developmental problems and handicap increases as the baby is more preterm. When a baby is extremely preterm, the risk of dying or getting a significant brain injury and handicap is 25%. We as neonatologists are good at dealing with the respiratory problems or breathing problems, but we have until now not so many means of protecting the brain. So we need instruments to help us to measure the oxygen sufficiency of the brain, the blood supply to the brain.
A European research project is developing a prototype for such an instrument. It's being tested in 2 hospitals, in Copenhagen and here in Milan, for now only on babies born at full term.
This highly sophisticated technology actually consists of a light that comes out of these emitters. The probe is simply placed on the newborn's head. We cover up the eyes, but the instrument is programmed to be absolutely safe for the newborn.
This optical instrument allows real-time and highly accurate measures of the flow of blood and oxygen to the brain. And it's a non-invasive technique, which is very important for doctors.
Entering a neonatal intensive care unit is extremely stressful for parents. The goal for us is to find a balance between technology that can change the diagnosis for these babies without disturbing them.
9 universities and institutes across Europe collaborated to develop this prototype. The project coordinator works in the physics department of the Polytechnic University of Milan. Here, researchers explore various innovative optical technologies.
So what we're doing here is what happens on the baby's head.
Yes, a fiber probe illuminates the brain and another one collects the light, as red and infrared lights allow us to see through body tissue. This technique complements magnetic resonance imaging, MRI. It provides the same information, but with a much more compact technology that is cheaper and that you can bring right next to the baby's cot or the patient's bed. The hope for this project is to pave the way to have this instrument on the market in 3 to 5 years, to provide neonatal specialists and hospitals in Europe and around the world with a tool to closely monitor the health of premature babies.
The results of the clinical tests are expected in the next few months. Researchers, doctors, and parents all want the project to succeed, to give these tiny little creatures the best chances for a healthy life.